Heartiest greetings to all the faculty and delegates who are participating in EmergeNZ 23 conference organized by Aster Emergency Medicine Department. I'm very happy and proud that this is happening. It would have been my pleasure to be there physically, but unfortunately I couldn't travel. But I wish all the best for the conference. I appreciate the faculty as well as, most importantly, the delegates who have taken the trouble to come over there. The organizers have done a fantastic work. I was going through the brochure. The depth and breadth of the areas of emergency medicine which are covered, there is no limit to that. It is so comprehensive. I appreciate Dr. Venugopal as well as Dr. Johnson, and along with them, the whole organizing committee who have been in the forefront of this, and also the team, administrative team who have supported them. Coming back to emergency medicine in general as well as in Aster especially, we started this journey in 2002 at Aster MIMS Calicut. Dr. Venugopal, whom I call the father of emergency medicine in Kerala, has been in the forefront of this, and last 20 years he has been living emergency medicine day in, day out. And of course, his colleagues like Dr. Johnson and all, who came a little later, but they are also taken up that flag and flying it very high. Now, what happened initially was the whole concept had to be changed. I remember when we were medical students as well as when we were practicing, and when I was teaching in the medical college, those times, emergency medicine is one place where you will have the junior-most person sitting there. And that's the worst thing that can happen, because that is the question of life and death. That's a phase of the hospital, 24/7. And if you don't have highly qualified people who can take decisions and act, the whole healthcare is in peril, according to me. That was what was happening earlier. We all know that house surgeons used to be the people sitting in the emergency medicine department when we were students. I don't know how it is now, but that's a very, very deplorable situation. But now this whole thing is changing world over, and Aster took a strong initiative in that in 2002 at Aster MIMS Calicut. Now, we started the MEM course there in association with George Washington University, which helped in training large number of graduates in the emergency medicine area. And after 3 years of postgraduate training, they are now there in the different parts of the state as well as other parts of India and outside India also. I see regularly large number of MEM graduates coming into GCC countries for job, as well as they have gone into Western countries like UK and USA and all. So this really helped the MEM courses, not only in MIMS Calicut, but in other places also this was started, and other institutions also started that. And after that, it has been a sea change in the way in which case the whole name changed from casualty into emergency medicine. And the way in which the patients who are coming there are handled, that is entirely different from what it was earlier. They are assessed in the proper way, interventions are done, and once stabilized, they are handed over to their respective departments. So that has produced excellent change. And also even the paramedics and all going out to retrieve the patients or receive the patients, and the way in which this has changed, the mobile ICUs, as well as mobile medical vans, and recently the 5G ambulances. All this has changed the way in which the patient is brought to the hospital also. So on the whole, what has happened is that there have been a lot of lives being saved through this. And we all should be proud that this is happening, and we all should be relieved that this is happening. Now, what we wanted is to share this knowledge from Aster as well as from outside, with other faculty, and share this with the people who are not having that direct access to that. We hope that this will help the people outside the system, as well as even doctors inside the Aster system, to learn more, understand more, and put it into practice so that more and more lives can be saved. I wish you all the best. And once again, congratulate the organizers for doing such a wonderful work in the toiling hard in the last 6 months. Thank you very much. Jai Hind.